Hi, this is Victoria Smart, and today we're going to be measuring input and output from a patient. First, I am going to verify my healthcare provider's orders. I'm going to gather my necessary equipment and supplies, perform my hand hygiene, and then provide for patient privacy. I will introduce myself to the patient and the family if present, identify the patient, asking them to give me their full name and date of birth, and comparing that up against their wristband. I'm going to explain the procedure to the patient and ensure that I gain consent. I'm going to assess for signs of fluid imbalance, assess the weight of the patient daily, check for changes in urine and the differences of hematocrit level daily. I'm going to measure and record the patient's intake of fluid, um, record and measure the immediate to ensure accuracy. I'm going to explain the need for measuring the input and output data to the patient and the family, assessing the patient and family's ability and wanting to participate in the process. I'm going to ask the patient and family to use the call light when the patient has become, or if the patient becomes incontinent, starts to vomit, or is sweating profusely. Next, I'm going to inform the patient and family that drainage sites are being closely monitored. I'm going to explain the contents are measured and recorded, and ensure that the patient has a graduated container with their marked name and date on it. I'm going to apply clean gloves, measure the drainage as indicated using appropriate containers. I'm going to note and assess the color and characteristics of the drainage. Measure in larger container pouches by pouring it into a graduated or measured cup or container. After I have assessed all the drainage and the input and output, I'm going to help the patient into a comfortable position, making sure that their personal items are within reach, making sure that they know where their call light is located and how to use it in case they need me. I'm going to raise the side rails, which I was working on, and lower the bed into lowest position for patient safety. Then lastly, I'm going to dispose of all my used equipment, remove and dispose my dirty gloves and perform hand hygiene. And then I'm going to document the input and output balance or imbalance that was found, making sure that I'm documenting any low urine output or significant changes in the patient's daily